It's not an exaggeration to say that our ability as a country to rein in healthcare spending is really going to determine our fiscal future. Healthcare, more than any other government entity, is really what's driving our debt. To put this in perspective, the Congressional Budget Office has estimated that over the next 50 years, the government's projected to spend $37 trillion more on healthcare than we're going to take in taxation. To put that number in perspective, in order to fill in that gap, we'd have to raise the top marginal tax rate to 92%. And at that point, we start making Sweden and Denmark look like a clam bake. And that's the issue that we're confronting. And so what we've done in this London School of Economics Yale report is try to sidestep the politics and explore what Governor Romney and President Obama are proposing to do to the U.S. healthcare system. So essentially there are three core challenges that the U.S. healthcare system is facing. First and foremost is this question of access. Right now we've got 45 million Americans, about 16% of the population, who don't have access to insurance coverage. And clearly this has dire consequences for these individuals, but it also drives up healthcare spending for everybody else. We pay more when those individuals access the healthcare system, and we have to subsidize uncompensated care. And when those individuals ultimately become part of Medicare, they cost the system more money because essentially treatment is more expensive than prevention. Now, the second issue is that we spend significantly more than any other country on healthcare. About 15 to 20% of our income goes towards health, and that compares to about 10% in most other rich nations. And the third issue is it's not entirely clear that despite spending more, we get better quality. Now, at the end of the day, we've got life expectancy in the U.S. that falls below Greece and Spain. 100,000 people each year die from medical errors. It ends up being about the 6th leading cause of death in the United States. And we can't go on in this situation where we're spending more and getting less. If he were re-elected, President Obama would fully implement the Affordable Care Act, which he passed during his first term. Now, the Affordable Care Act really has twin aims. The first is to make the U.S. healthcare system more efficient, to reduce long-term spending. And the second is to expand access. So in order to make the U.S. healthcare system more efficient, what President Obama is really proposing is to do to healthcare what Walmart did to the manufacturing industry, and that is to use the position of the government as the single largest player in the health sector to prompt providers to really step up their game. So first and foremost, he's changing the way he's paying providers. Right now we have a system that pays for quantity. They're hoping to shift that towards paying for quality. So for example, if you're a hospital with high readmission rates or high infection rates, what we're going to see is you're going to be paid less under the Affordable Care Act. Now, on the insurance front, in order to expand coverage, the President has done three things. The first thing that he's done is mandated that everyone come in and buy insurance. And this is really with the aim of getting these markets to function more effectively. What we don't want to see is that folks who are healthy waiting to get insurance until they get sick and really free riding off the system. The second thing that he's done is he's subsidized insurance coverage for the folks who previously couldn't buy it. And the third thing that he's done is expanded federal programs and regulated the insurance market. So that insurance companies can't do things like discriminating against individuals because they have pre-existing conditions, or placing lifetime caps on insurance coverage, so that when you got sick or in the middle of your care, an insurance company can't come in and say, stop, you've reached your limit. And the final thing that he's done is tried to make the insurance market much more transparent. So that you as an individual can compare plans across different companies, and if you don't like the care that you're getting now, the coverage, choose to switch. And the whole idea here is predicated on this notion that markets for healthcare are different than markets for tomatoes or any other commercial goods, and that they do require government intervention. Governor Romney has a very, very different proposal when it comes to healthcare. What he said is that first and foremost, on day one, he will repeal and replace the Affordable Care Act. Now, what he's argued is that the federal government should have a much smaller role in health policy and that really the states should come in and take over. Now, what he's proposed is switching Medicare and Medicaid from being defined benefits to being defined contributions. Okay, right now, the government dictates the package of benefits that you receive: hip replacements, knee replacements, certain surgeries, certain medications. And the challenge is that when those items become more expensive over time, the government's on the hook for more and more money each year. What Governor Romney is proposing is to give individuals a defined amount that gets bigger over time, but that is limited in its growth rate. And the idea is that that cost pressure will slow the growth of healthcare spending over time. And the third thing that Governor Romney has proposed is to turn Medicare into a voucher system. So you could take that money from the government, and if you weren't happy with your Medicare, choose to purchase insurance from the private sector. And that has the hope of using competition as a vehicle to reduce healthcare spending. At the end of the day, healthcare spending is really what's driving our deficit. So whomever is elected president in 2012, this is the challenge that they're going to have to face. Governor Romney and President Obama have proposed two very, very different visions. Governor Romney has really proposed that states should take the lead, whereas President Obama has argued for a much stronger role for the federal government. And really the debate between the two is this question of how do we make markets in healthcare function more effectively? Okay, President Obama has argued that you do need a strong role for the federal government in doing things like mandating insurance coverage and changing the way we pay doctors to get the system to work more efficiently. In contrast, Governor Romney has argued essentially for less regulation, to give more control to the states, and allow competition to be the vehicle in unregulated markets to drive change. I tend to come down on the side of the Affordable Care Act. It's not a perfect piece of legislation, but I like to think of it like the foundation of the house. It isn't pretty to look at, it isn't a complete project, but what it does is it builds creates a structure for us to build on. And that's what we need ultimately in the long term to begin to get healthcare spending under control.